I did my project on Chapter 1, A Career as a Health Insurance Specialist. What is a health insurance specialist? A health insurance specialist is someone who manages and oversees the financial aspects of patient care within a healthcare system or a facility. They mainly focus on insurance claims, processing, billing, and other related matters to ensure accurate documentation and compliance with insurance regulations to maximize reimbursement for providers. There are several qualities that you need to be an insurance specialist. The most important one I feel is attention to detail, meaning that the person uses meticulous and precise approaches when they perform tasks. Next, one must have effective communication skills, such as active listening and excellent writing skills. You also must have a knowledge of coding systems, meaning that you must keep up to date with all the coding guidelines and any revisions to guidelines that are made, etc. Next, an insurance specialist must have problem solving skills, which means you must have analytical, critical, and creative thinking. Lastly, an insurance specialist must have time management skills, meaning that they are someone who establishes goals, they prioritize tasks, and they meet deadlines. What is the scope of practice for an insurance specialist? The definition of the scope of practice is that they interact with patients to clarify their insurance coverages and financial responsibilities. They process insurance claims, appeal denied claims, and analyze data. Some qualifications that you must have to be an insurance specialist is you must graduate from a health insurance specialist program or equivalent. You must have experience in health insurance or a related field. And then you must also have a working knowledge and demonstrate proficiency of at least one insurance company's billing and collecting processes. Some responsibilities of an insurance specialist is that they use medical management software to process health insurance claims. They assign codes to diagnoses and procedures and services, and they also manage patient records. And one other thing that they do is they also communicate with patients and providers about coverage and reimbursement issues. And they also remain up to date regarding changes in the healthcare industry's laws and regulations. Is there any supervision required to be a health insurance specialist? Experience as active and continuous supervision of a health insurance specialist is required. However, the quote-unquote supervising specialist does not need to be present on the premises for responsibilities to be performed. Some career opportunities. First off is a coder. And a coder applies knowledge of coding systems, including guidelines and regulations, to accurately assign ICD-10, CPT, and HCPCS Level 2 codes to procedures and services that are documented in the medical record. Another career opportunity is a reimbursement specialist. And these specialists review health-related claims to match medical necessity to procedures and or services that were provided before payment is made to a provider. career opportunities continued. A third career opportunity is a claims examiner. And a claims examiner is employed by a third party payer, and they review health related claims to determine whether the charges are reasonable for the medical necessity. And then lastly, we have health information technicians. And these specialists, they manage patient health information and medical records, administer computer information systems. They also code diagnoses and procedures for services that are provided. There is education and training that is needed to be a health insurance specialist. One of the main courses that you need to take is anatomy and physiology, medical terminology, pharmacology, and pathophysiology. And taking these courses is needed because having a knowledge of the anatomic structures and functions of the body, as well as medical terminology and the essentials of pharmacology, are necessary to recognize abnormal conditions within documentation. Another course that must be taken, you must take a diagnosis and procedures, as well as service coding class. These courses will help you understand rules, conventions, and applications of coding systems that ensures proper selections of codes, which are reported on insurance claims for reimbursement. Another course that is needed is verbal and written communication. This course is needed to help explain the complex insurance concepts and regulations to patients, and the insurance specialist must effectively communicate with providers regarding documentation of procedures to reduce coding and billing errors. You also need, or it is suggested that you take a critical thinking class. And this course will help you differentiate among the technical descriptions of similar diagnoses when it comes to ICD-10 and procedures like CPT or PSC coding. Sometimes just one little word will make it a completely different code. Just one little word determines which code you use sometimes. Another course that it is recommended that you take is data entry. Because nowadays federal regulations require that the majority of insurance claims be submitted electronically, which means that one must have pretty good keyboarding skills because you don't want to accidentally make an error and the claim get returned just because you accidentally type something wrong or transpose something, what have you. Lastly, a health insurance specialist, it is recommended that they take a course on, or they be trained in internet access, because they need to be trained in internet access because nowadays a lot of online information sources provide access to medical references. A lot of the insurance companies' manuals are online, as well as procedure guidelines are online as well. Um, a lot of health insurance specialists will do a student internship. A student internship gives students on the job experience prior to graduation. And during this student internship, the facilities actually benefit as well from the opportunity to participate in and improve the formal education processes for future employees. And lastly, this is actually I consider this a benefit of the student internship. Quite often, students who complete internships actually, if there is a job opening at the facility that they did their internship at, more times than not, they'll actually get offered that open position.